Thank you. Thank you very much, Chair, for the opportunity to share our experiences on a project that we're implementing in the 3 East African countries. This project builds on the work alluded to by Amos and Hiba, work led by Professor Michel in Ghana and Kenya, and also the Mills NCD project in Ghana. So this is more of a really grandchild of those projects. And then we have extended this work to now 2 other East African countries, that is Tanzania and Uganda. This is a product of collaborative work among 7 institutions, the African Population and Health Research Center, with VITS Priceless leading this work, and with in-country partners in Uganda and Tanzania, that is Fakara Health Institute and the EPRC in Uganda. We have support from France by Professor Stephanie, and also from Belgium rather, and then from France by Professor Michel, and then Ghana, Amos. Why is this project needed? As alluded to by other speakers, we are experiencing a rising burden of NCDs in East Africa, with the countries reporting about 1/3 of the mortality attributed to NCDs. There's lack of evidence really about how food environments drive dietary behaviors, because most of the research is focused on individual level factors through national surveys like the STEP surveys and DHS surveys. There's very little about the food environment research. Yet we know individual level approaches have limited success when we don't account for the wider context. As Christopher showed before, I got this from Christopher's publication. Before 2017, there were only 2 countries in Africa that had done food environment research. That's Ghana and South Africa. So this work is really more pioneer work in East Africa. And our focus is on the 2 outer levels. That is the macro level, the policy environment, and then the physical environment, looking at school environment and neighborhoods and communities and outlets for selling food. What are the aims of the project? We are looking at assessing the gaps related to development and implementation of food environment policies in Tanzania and Uganda. We already did this under Michel's project in Kenya. We're building this now in Tanzania and Uganda. However, the food AP approach that we used in Kenya before could not capture the barriers and facilitators to the development of this. So we're now including Kenya in the second objective and also doing this in Tanzania and Uganda. We would like also look at the frequency and nature of unhealthy food marketing to children and the power of promotions in Kenya, and also estimate the economic burden of particular nutrition-related NCDs in the 3 countries. And then finally, design context-specific interventions, regulatory interventions, using our work from Objective 1 and feasibility and administrative legal assessments. This work will be a cross-sectional study, mixed methods, delivered through 4 main work packages. Work package 1 will really be benchmarking the food policy environment in Tanzania and Uganda, and then also looking at the barriers and facilitators of the implementation in the 3 countries. And the work package 2 is food promotion, which covers objective 3. This will only be done in Kenya, where we shall look at adverts on TV, radio, around schools and in supermarkets of unhealthy foods to children. Work package 3, we will estimate the economic burden of nutrition-related NCDs in the 3 countries. This is mainly going to be based on secondary data from published work or from the surveys like the DHSs and STEP surveys. And then work package 4 is really looking at the political and legal feasibility of a package of interventions in the 3 countries. This work is nested within a wider global recap program led by led by WHO in collaboration with IDRC and IDLO. So we hope the findings from this study will inform interventions immediately, since policymakers have already been engaged in the wider global recap program in the 3 countries. In work package 1, we shall use this Healthy Food Environment Policy Index. I'm sure there's a training on this tomorrow. I'll not waste time on this. But this index has 13 domains with specific indicators which will be adapted to each country context to look at really the level of implementation or development of the various policies and comparing this with international benchmarks. This work was started in April this year. So in the 2 countries, Tanzania and Uganda, we have started adapting the tools. Specifically, we are looking at adapting these tools to each country context to capture the double burden of malnutrition and also food safety. Because from our work in Kenya, we established that these factors were very essential in low middle income countries, as they also contribute to NCD risk factor on unhealthy food consumption. In the 2 countries, we're already doing the desk reviews to identify the policies available. Then the next step will be to convene policymakers to validate the evidence that we will gather from the various sources. And then we will invite them also for a workshop to assess and rate their policies against international benchmarks. And then finally, they will identify and prioritize government actions needed in terms of importance and feasibility. This will be followed by key informant interviews with 10 key policy and decision makers in each country to explore the experiences, successes, and challenges in developing these policies, and also explore their perceptions about the importance of the cost information that will generate decision making. As we know, many low middle income countries are focusing on actually food insecurity. They do not view NCDs as a priority. So this costing exercise will help in looking at the cost burden of these NCDs in the countries. Finally, we will also assess the political and administrative possibilities through the informant interviews. In work package 2, we will do a survey of schools around Kenya. We will sample up to about 500 schools. Based on the experience in Ghana, about 50% of advancement happens around the schools. So we came up with a sample size of about 500, which will be distributed in 3 regions. The coastal region, where we'll select Mombasa. Then the central region will have Nairobi. And we shall get a rural area in Baringo County, in the Rift Valley region, to also select some schools. So the 500 schools will be really distributed in the 3 zones. We will also identify in well-defined geographical areas, those are sub-counties, look at stores and supermarkets and the level of advancement in those settings. We will use the standard Informas tools and methods for collecting this data. We will also collect advancement data from TV. We'll select 3 popular TV stations in Kenya. These are mainly the free-to-air and also radio stations, and capture the advancements over a period of 3 months. In addition to these methods, we will also do qualitative interviews with policymakers, school authorities, media houses, and store managers. In work package 3, as I mentioned earlier, we want to generate evidence to support the adoption of fiscal and regulatory interventions in the countries. So we'll do this by estimating the true cost of NCDs and enhance the case for investment. We will undertake cost of illness studies in the 3 countries, informed by the policymakers in our qualitative interviews. They will tell us really which NCDs they would prefer us to cost, whether diabetes or hypertension. And then we will develop these models for costing and generate these to drive decisions. In work package 4, we will employ both desk review or systematic reviews, really to develop context-specific regulatory interventions in these countries. So we'll try to learn from other countries by reviewing their laws and looking at what methods they use to adopt and implement interventions, and then use these really to engage the national governments to look at how best these policies can be implemented in these countries. Work packages 3 and 4 will be supported by our partners from South Africa, where they have experience driving food environment policies recently. And I'm aware that tomorrow, Professor Hoffman will be sharing some experiences on what they did in South Africa. So I was asked to think about 3 top food environment research priorities for Africa. From our experience already doing this work, starting from the work led by Michelle and also Amos, we see that the double burden of malnutrition is an issue in the low middle income countries. So when we're thinking about addressing NCD policies, it's important to look at undernutrition as well and address double duty actions. So we're already starting to actually adopt our tools to capture, for the indicators to capture double burden of malnutrition. Because some countries are already actually questioning, is our problem really NCDs or it's undernutrition? But actually we could have interventions which still tackle both undernutrition and overnutrition. Secondly, we should look at associations between food environment exposure.
Rounding up for us, please.
Yes, this is my last slide. Thank you. Yeah. It's important to link our associations of the food environment exposures to health outcomes. The reason why the uptake of policies is very poor in these countries is that most studies do not link these burdens of dietary, unhealthy behaviors, whatever, to outcomes, nutritional or health outcomes. Then we also need proper longitudinal or experimental studies, which can really look at the role or the impact of the interventions to health outcomes. Thank you. So this work is really funded by IDRC, who acknowledge this support and also acknowledge the support from our partners. Thank you very much.